reality is that we don't need violence workers to do the vast majority of that work.
So my concern is that defunding the police will dismantle the reforms that have been put in place and will set police reform back in ways that no one on any side of the current issues will want to see.
Welcome to another episode of Hear Both Sides. I'm Nina Cassine, and I'm your host. Joining us, we have Professor Alex Vitale. He's a sociology professor at Brooklyn College and the coordinator of the Policing and Social Justice program. He's also the author of The End of Policing. He believes that the answer to police violence is to defund the police. On the other side, we have Professor Jacqueline Helfgott. She is a professor and the director of the Crime and Justice Research Center at Seattle University. She also serves in the Seattle Police Department Crisis Intervention Committee. She is arguing against defunding of the police. So, defund the police. Well, most of us first heard that slogan in the aftermath of the death of George Floyd in May of 2020. We all want to live in safe neighborhoods. We all want our families to be safe. But the question is this: is policing our best option, or could those budgets be better spent elsewhere? So here we go. 6 questions, 2 people, 12 minutes. Decide to listen, listen to decide. So for the first question, Hear Both Sides asked both of them to define their stance on the topic of defunding the police and tell us why they believe it's an important issue in today's society.
Some people have misrepresented the concept of defund the police by claiming it's about let's just get rid of all police and leave people on their own to figure out what to do next. But this movement is in fact focused on creating evidence-based strategies for improving public safety to a degree better than just relying on police and without all the negative collateral consequences of criminalization and mass incarceration. Defund the police is also a signal that people are rejecting the idea that we're going to fix policing with a series of superficial procedural reforms, like body cameras and community policing. It's also a rejection of the idea that if we just throw a couple of police officers in jail or create some oversight bodies, that this will cause policing to reform itself. Instead, we need to ask why we've turned every social problem under the sun over to police to manage and come up with better solutions.
You know, I support much of what the defunding proponents are calling for, and have conducted research in those areas: restorative justice, reentry, demilitarization and law enforcement, police community engagement. However, I do not support defunding because my concern is that the defunding movement will unravel over 50 years of evidence-based practice in policing and criminal justice. That is a striking example of how far we have come in criminal justice and police reform. So my concern is that defunding the police will dismantle the reforms that have been put in place and will set police reform back in ways that no one on any side of the current issues will want to see. My concern is also that defunding has the potential to increase fear of crime and quality of life, and harm victims, especially in marginalized communities. A situation will be created where communities that have more wealth will be able to hire private security, and the impact of that will be harm to victims, harm to marginalized community.
The next question was posed by Professor Vitale. The CAHOOTS program in Oregon is used to send a medic and a crisis intervention worker together to respond to mental health related crises. Do you support this kind of model?
There are co-responder teams in other cities, including Seattle. There's some differences. For example, in Seattle, we have had police officer mental health professional co-responder teams since 2010, and just last year got 5 of those co-responder teams. But even in Seattle, I hear people bringing up the CAHOOTS program. What about the CAHOOTS program? As if it's the first ever of these programs. There's been research on crisis intervention in law enforcement since the Memphis model in the early 80s, and a lot of gains have been made. I have concerns that what's already going on, for example, like in a city like Seattle, is being ignored, and we're being asked to look at this other city over here when we're already doing much of what this other city is doing.
Between 1.25% of all people killed by police in the United States are having a mental health crisis. And while most interactions between police and people in crisis are resolved without that level of violence, it is a huge problem. We have systematically defunded mental health services across the United States and then given that problem over to police to resolve. And they lack the training and the resources to successfully deal with these calls. The CAHOOTS model involves using trained outreach and clinical health specialists to try to reduce the possibility of bad outcomes in these cases. It's been tremendously successful, and it's a model that's being replicated increasingly across the country. It's one way that we can reduce the burden of policing on some of the most vulnerable communities in our society.
This one was asked by Professor Helfgott. Do you think that the police should be defunded, or would it make more sense to have police work as collaborative partners with civilian personnel, such as mental health workers, social workers, and park staff?
One of the arguments that's being made against the possibility of reducing the role of policing in crisis response is that everything is potentially violent, that police are dealing with violence constantly, and this is really a misstatement about the nature of the vast majority of what police do. Between 85 and 95% of all police responses have nothing to do with violence. In fact, many have nothing to do with even legal issues. They're responding to perceived nuisances, disorder, etc. Noise complaints, loose dogs, trash problems, someone, sleeping outside, someone talking to themselves, walking down the street. And the reality is that we don't need violence workers to do the vast majority of that work. Other societies have figured this out. They send a variety of non-police personnel to respond to these kinds of problems. And in fact, the presence of armed uniformed police is often destabilizing in these encounters and makes the violence more likely. What people are calling for is some real assessment about reducing our reliance on policing.
What we need are community collaborative teams. That's the answer, where police are charged with the public safety arm of that, where mental health professionals, social workers, other city workers are charged with other aspects of that. Things like what we have in Seattle that actually the defunding movement has removed, such as the navigation teams, where police have worked with social service professionals to help deal with help unhoused persons. So we need co-responder teams, collaborative teams where police are part of the solution, where everyone is working together, not with this us versus them.
Professor Vitale came up with the next question. Do you support efforts to decriminalize drugs and switch the problem to public health authorities, as has been done in Portugal and as Oregon has just voted to do?
We've been waging this war on drugs for over 40 years now. No lives have been saved. No communities have been made better as a result. We've put literally millions of people in prison on drug charges, and young people can get any kind of drugs they want whenever they want them. Any high school student in America has access to any kind of drugs they want. And the decision whether or not to use drugs is not based on the threat of police intervention. It's based on the stability of families, it's based on public education, it's based on public health questions, and it's based on young people making decisions about the kind of life they want to lead. By turning the problem over to the criminal justice system, we've created a massive underground illegal black market that is responsible for violence, overdoses, abuse, and mass criminalization. It's time for a new approach.
Again, it's difficult to disentangle drug use, drug abuse, open air drug market activity, things like that with public safety risk. So if we have a plan in place, yes. If we have collaborative teams to help address this issue, yes.
This one was asked by Professor Helfgott. Over the last 50 years, there have been great strides in evidence-based policing and criminal justice, data-driven policies and practices, increased police professionalism, and recruitment of women and BIPOC law enforcement officers. What makes current calls for criminal justice reform different or more promising than the past?
The last kind of line of defense against reducing police budgets and investing in communities instead is the argument, don't worry, we're going to fix policing. We're going to diversify police forces. We're going to improve training. We're going to create community policing. But this stuff doesn't work. A few studies show very minimal improvements in one metric here and one metric there, but across the board, the levels of police killings continue. The levels of unnecessary arrests continue, and the rejection of police-centered approaches to our problems is growing. The officers involved in the killing of George Floyd were diverse, had had implicit bias training, were wearing body cameras, were operating under new use of force policies, and it made no difference because his life didn't matter and the police shouldn't have been there in the first place.
The problem I'm having with much of the defunding discussion is that there's a call for dismantling and rebuilding. And the point I would like to make is that science matters. We've come a long way in criminal justice research. My concern is that the call for defunding will dismantle 50 years of criminal justice reform. I've not been presented with data that shows a plan to explain how defunding the police will solve all of the historic social problems and systemic racism. The answer is to build on reforms that have been put in place since the 1967 President's Commission on Law Enforcement and Administration of Justice, and then the gains that have been made, for example, in Obama's task force on 21st century policing. All we need to do is look at the progress that has occurred over the last 50 years. I am not convinced that defunding is going to do anything but set us back.
Then we gave both professors a chance to hear each other's interviews. Let's hear what they had to say.
Well, I'm very glad that people have had a chance to hear two important perspectives on this issue. The reality is that yes, we have had 50 years of sustained efforts to reform police. We've had commissions and studies, and we have had millions and millions of dollars poured into police reform in a variety of different styles. But the reality is that what we've gotten out of that is mass incarceration, the mass criminalization of the most vulnerable communities in our society. The fact is that police in the United States commit between 5 and 10% of all homicides, whether lawful or otherwise. Does this mean that reforming or improving policing is impossible? Well, it is certainly possible that we can make small incremental reforms to certain aspects of policing. But the problem is that even professional, unbiased, well-conducted policing still represents an incredibly negative burden on the communities subjected to it. A lawful, procedurally proper, unbiased, low-level drug arrest is still going to ruin some young person's life for no good reason. And the reality is that policing is overwhelmingly focused on the most vulnerable communities. The solution to this is to follow the demands of the movement for Black lives and to reduce our reliance on policing and invest instead in community-based public safety strategies.
I really appreciate that everyone had the opportunity to hear both sides. My final just sort of comments on this are that What matters most here is paying attention to the science and the fact that science matters in terms of the reforms that have been put in place. Police are often excluded as a part of public safety and harm reduction. And that ignores years of research and evidence-based practice that has been put into place in police reforms. And conversations about removing police from the equation are real and unrealistic in terms of the role that police actually play in the day-to-day lives of communities. The defunding argument has argued that police should be reserved for violent crime, and mental health and social service and other community agents should be responding to crime. And the reality of the situation is that the world doesn't break down into safe and dangerous, nonviolent and violent. The incidents that police come upon every day are very complex, and it's very difficult to disentangle human behaviors to a situation where we're going to say, the police respond to these types of incidents. Police have the training in de-escalation, crisis intervention, and we need the police as collaborators. And if anything that can come from this moment in time is that we recognize what defunding proponents are saying, which is decentralized policing in response to public safety. However, what we need to do, and that I agree with that, we could potentially do that, but at the same time, we cannot remove police from the equation.
So be sure to share this episode with your friends and with your enemies, because it's really easy to take sides when you only know one of them. Click below to subscribe.